Hello and welcome back to Meta-Humanism podcast. Today we will continue looking at the anti-psychiatry movement, its influences and its consequences and legacies, how it changed the mainstream psychiatry, and how another movement called critical psychiatry emerged subsequently taking into account some of the criticism of anti-psychiatry. Last time, in the last episode, I introduced this topic by looking broadly at philosophy as therapy or as healing of our minds and souls. With that setup and introduction, which I encourage you to go and watch before watching this video, this episode, because it sets up and provides some background and context. It's up to you, obviously, but I suggest that you do watch that first, because today we're going to be focusing specifically on anti-psychiatry and critical psychiatry and how they developed. So the approach I'm taking is historical. I will look at historical periods, starting with ancient times, and how mental disorders and suicide specifically were treated or understood or theorized about in those different periods, and also practices, how practically they were addressed. So start with the ancient philosophy, which was emerged as pursuit of truth and knowledge. We started looking at that, epistemology, how we can know truth about reality, about ourselves, about life, and how we can distinguish truth from falsehood and true knowledge from no knowledge at all. But that pursuit was not seen as something separate from therapeutic and ethical life. And therapeutic healing process. So both therapeutic dimension of healing the mind and the ethical process of living a good life were seen as part of philosophical endeavor, of philosophy as practice. Especially the classical ancient Greek philosophy of Socrates, Plato, and Aristotle is when the ethical emphasis of care of the self or care of the soul emerged most prominently. And there's a connection here to a 20th century historian, philosopher, post-modernist and post-structuralist thinker, Michel Foucault. He actually is one of the thinkers that is part of the anti-psychiatry movement. Considered one of the influences and shaped that perspective. And he wrote a study about madness and civilization, or I think originally was called History of Madness, depending on what edition and what language it's in. The English translation was called Madness and Civilization, 1961, I believe is the year when it was published. And it looked at 17th, 18th century, most specifically about how psychiatry came to be defined as a separate discipline, a separate kind of medicine, and how it developed into the modern age. And he, towards the end of his life, he also had a history of sexuality project, which started with looking at the Victorian 19th century understanding of sexuality and how it influenced the modern time, the 20th century, and then he turned to ancient Greece and looked. And the following two volumes within that series were called "The Care of the Self" and "Use of Pleasure." If you look at two different ways of kind of ascetic ideal of caring for the self and disciplining oneself, and then use of pleasure, more hedonistic approach. And then he started preparing the fourth volume, was focusing on medieval Christian understanding of sexuality, called Confessions of the Flesh. But that was his life was cut short, and he didn't publish it when he was living. It was published recently based on his notes and lectures and that he left behind. So that's just a connection because he's one of the leading thinkers of the anti-psychiatry movement. And so returning to ancient Greece, Socrates, Plato, and Aristotle. Aristotle, most specifically, he formulated this concept of eudaimonia, which is flourishing in our terms. It's sort of like equivalent of happiness. In ancient times, they didn't really think of happiness the way we do today, as something, as a goal for life. Eudaimonia was or for Aristotle, was the goal for a good life, and that was more of a holistic approach of a virtuous, ethical kind of being that's not just focused on pleasure or happiness. It's more holistic than that. So besides that classical point of view, Stoicism and Epicureanism also took their root in Greece, but developed more comprehensively in the Hellenistic times after the classical Greek culture, and in Roman times. So that was two different perspectives. They were kind of competing perspectives, but in some ways some similarities. But Stoicism more specifically focused on enduring adversity, hardship, and suffering in a virtuous and rational and dignified way. Rational control of emotions, aligning self with the nature, with natural order, not struggling against nature, but being in harmony, or at least aligned with the way things are. Journaling, self-contemplation, meditating on death, to be more grateful for life. So those are where the therapeutic approaches for Stoicism. Epicureanism, Epicurus was a physician, and he saw philosophy as medicine of the soul, and medicine as philosophical. And medicine was actually a Greek word for medicine is pharmakon, which is where pharmaceuticals and pharmacological come from. And the Epicureans focused more on freeing people from anxieties and fears, irrational fears like a fear of death. And focusing on gaining pleasure from simple things, from basic things, small things in life, and just living a contented, happy life. Contented more is probably more accurate than happy life. So those were the major perspectives in ancient Greece. And so mental disorders in those times were treated either religiously or philosophically. Philosophically, I just described how. Religiously, more with rituals and exorcisms, depending on a particular person's perspective and what help they sought. It could be just like today, some people seek spiritual guidance in religion, others go to a therapist, a secular therapist, and so on. Suicide was treated differently by different schools of thought. Potentially it was acceptable in some situations, but generally speaking, you could generalize it was seen as an evil, as a wrong thing to do. For example, Plato in his dialogue Phaedo thought it generally wrong because life is a gift from the gods. So taking your life means you're refusing that gift, and it's wrong. Unless he did allow for some exceptions, such as if the gods send some kind of sign to a person that he or she should take their life, or there's some extreme injustice that justifies taking one's life. So Aristotle, in his Nicomachean Ethics, he condemns suicide, but for different reason. His reason for condemning and thinking it wrong and unjust is because it hurts the community. It's a social reason. So, and indeed, suicide in modern times will, when sociology emerges, will be seen as a social issue, not just an individual problem. Stoics had a very unique approach, again, because of this idea of Stoicism, or enduring hardships in a dignified manner. They had a view that suicide can be rational and even virtuous, depending on the circumstances. So if a person is prevented from living a full life based on rationality, on reason, and virtue, if they are somehow prevented from living that life, they may be justified, and it may be rational and virtuous of them to take their own life. instead of suffering and living an undignified, irrational, or unvirtuous life. Seneca, who was a Roman statesman, and he lived in Nero's time, he famously defended this idea of, quote, death is in our power, unquote, and suicide could be seen as an act of dignity and autonomy. That was his idea. The Roman law varied on that point. Suicide could be seen as a criminal act if, for example, a criminal was condemned to some punishment or execution even, let's say, but to avoid that, maybe it was a harsh punishment or some kind of a torture, or I don't know, whatever the judgment may have been, they took their life to avoid that punishment. That was seen as another crime. And but otherwise, sometimes suicide could have may have been seen as a indication or praised even for nobility. So, for example, would be Cato the Younger, who took his own life. His suicide was seen as a noble thing. So just an example. Next is medieval philosophy. And in medieval times, obviously the Christianity emerged, and Islam eventually as well. And so the theological and religious view became much more dominant. Philosophical probably receded slightly, although not completely. Galen in the 2nd century, he was a famous physician. He bridged philosophy and medicine, and he thought that every good physician also had to be a philosopher and know the issues surrounding medicine, philosophical issues. Then I mentioned last time I discussed Boethius and the Consolation of Philosophy, his major work. He was a Roman statesman, I'll remind you, who was condemned to being executed unjustly, and so while waiting, being imprisoned and waiting for his execution, he wrote this book about consolation of philosophy, imagining and consoling himself with philosophical introspection and reflection. But in general, Christian, Islamic, and Jewish medieval thinkers, and examples would be Avicenna in Islam, Maimonides in Jewish thought, and Thomas Aquinas, a major theologian in Christian tradition. They tried to preserve this unity of body and soul, not seeing them as separate, but as part of the same whole human figure, I guess, and in their medical philosophies and approaches to medicine. Another interesting thinker on the tail end of this medieval period is Paracelsus. He was in the 16th century, so it's a kind of late, it's almost towards the end of the Renaissance, but it could be seen as part of the same tradition. He represented a different, more of an underground and esoteric tradition. He criticized or challenged traditional Galenic medicine, Galen, which I just mentioned from the 2nd century. He was a radical thinker. He was an esoteric thinker. He was a mystic, alchemist, and a kind of precursor to modern science in that way. And he was also a physician. And he advocated for empirical observation, for chemical remedies, and a holistic view also of healing that united body, spirit, and the cosmos. So his thought influenced the development of modern science, but in medieval times, this perspective was less dominant and more of a secret, because the dominant perspective of a religious perspective saw mental disorder as a moral failure and spiritual failure, individual failure, and suicide was also seen as a crime and a sin. So a double, both the divine law and the law, the temporal law, sort of the secular law, although the separation was not really that clear at that time, and in medieval times it was. They both condemned the suicide and mental disorders as something, as a individual failure, moral and spiritual failure, and a crime. And so, as we know, as many of you may know, that suicides were not buried in the cemetery, but outside of the cemetery, and there was a lot of stigma attached to it, the whole family, and there was a lot of ostracism and opprobrium connected to that. Such major thinkers as Saint Augustine in early Christianity and Thomas Aquinas, which I already mentioned, they both condemned suicide very strongly. Now, the Renaissance time, that's the next period, humanism emerged and human dignity and autonomy became more, which I recorded this video in my introductory series about humanism. You can, if you haven't watched it, you can watch and get some background on that. But basically, they approached mental disorders and suicide from a more humane point of view. They advocated for humane treatment of those with mental illness, those who suffer from mental disorders. But their perspectives also varied, especially in terms of suicide, let's say. The three examples would be Erasmus of Rotterdam, a Dutch thinker, humanist. He wrote a book called Praise of Folly, excellent book. I suggest reading it if you haven't yet. And it was kind of an ironic philosophical examination of you could say stupidity, madness, unreason, but his subtle hint and his argument was that this kind of phenomenon, this folly or unreason or madness, may carry some sort of wisdom within it, and it's another form of wisdom that can reveal deeper truths about society. Think about figure of court jester, the only person who can criticize or make fun of the king without the danger of being put to death, right? Or king being offended and putting him to death. So the court jester is kind of speaking the truth, exempt from the norms of behavior, and this is the same idea that Erasmus was exploring. Second thinker is Montaigne. He was a French humanist, an early critique of religious stigma associated with mental disorder and suicide. He could be seen as precursor of more humane approaches later on in history. And Thomas More, a British humanist, he also emphasized more of humane approach, care of the mentally ill rather than punishment, because the dominant perspective tended to advocate for punishing, because seen as moral failure in the medieval times, there was this tendency to punish those who were mentally ill and the families of those who committed suicide. So the stances on suicide of all these three thinkers I just mentioned were very different. Montaigne saw it as potentially a form of moral autonomy, so continuing from the Stoic perspective, a philosophical one. Erasmus saw it as a sin, so more of a theological and religious perspective, and Thomas More saw it as tolerable in certain cases, but only if it's supervised by the kind of sanctioned by the authorities, if it's somebody who has terminal illness and suffers a lot. And so it connects to modern bioethical issue of euthanasia, and so it's relevant. Next period was the following Renaissance, was the scientific revolution and the Enlightenment, the growing out of that. And the major difference that emerged during this time is this split between the subject and the object. I referred to this in my previous discussion of humanism about the controversy about the thing and the word, philosophy and rhetorics. And so this kind of is an example of the Descartes, his famous "I think, therefore I am." He split up subject and object, separating also mind from the body, your thought as something disembodied, and defining very rationalist, abstract way. And so this was the split between the more abstract and rationalist perspective on philosophy and more technical approach to medicine and science. And medicine was basically treating just the body, focusing on the body and seeing the body as a mechanism, as a machine to be fixed, or to find out what goes wrong when it gets ill, and to fix it. Still informing Western medicine to this day in many ways. Another perspective, which was a rival to rationalism, was empiricism, and the thinkers like John Locke and David Hume, for example, they were kind of focusing on empirical investigation, observation, experimentation, and using your own experience, not some abstract rational ideas, to ground the knowledge. And so that obviously contributed to the development of the scientific method, but still, it also contributed to making medicine more technical and less philosophical, so splitting that up, philosophy and science as practices. and mind and body. Generally speaking, there was this tendency to exclude unreason, whereas the humanists tried to be more holistic about it. This scientific revolution and the Enlightenment was more trying to exclude those who were mad or unreasonable, and this is what Michel Foucault in his History of Madness describes it, quote unquote, great confinement, is when the people with mental disorders were put into asylum, separated from society, whereas before they may have been part of society, just treated badly or punished sometimes, but at least they lived among people. But they were separated and put into asylums, and sometimes treated very badly in those asylums. That was during 17th and 18th centuries. And the one famous asylum in London was called Bedlam, and it became a metaphor for disorder. Sometimes it is used as a cliche, saying, what is this bedlam? What is this disorder? Not even connected to mental diseases, but just in general, disorderly behavior. Enlightenment eventually, towards the end of or when the Enlightenment was in its heyday, and proposed the reforms, social reforms, and the more humane treatment, so building on a humanist perspective. And it was known as moral medicine. This was the kind of the early stages of the emergence of psychiatry as a separate kind of practice from general medicine. So it was just described as moral medicine initially, but this was when it started to become separate from the general practice of medicine, and figures like Pinel in France or Tuque in England, they were in charge of asylums, and they wanted to humanize the treatment and approach care of the mentally ill from a more humane perspective. This was also the time when critique of religious stigma emerged in full force. People like David Hume or Voltaire, who were very in many ways anti-religion or anti-clerical in their views. In many ways, they criticized religion in general. So their approach, Hume wrote an essay on suicide, and so his approach was more philosophical, that suicide may be permissible if it hurts nobody and is a response to extreme suffering, and so it may also be a kind of an existential question of personal liberty. So that was the continuation of that Stoic approach you can see through the centuries. Now we come to the 19th century, and these processes kind of continued. It was the mental disorders were continued to be medicalized, pathologized, separated into separate discipline and practice of psychiatry, and classified more specifically, and in the process often imposing inaccurate diagnostic labels, because these disorders weren't understood very well at that time. Even in our times, there is a lot of confusion, a lot of discussion and debate about how to categorize and whether all these labels that currently exist are even valid, or do they correspond to any reality, and do they describe our experience accurately? There's a lot of debate. So you can imagine it was no less problematic back in the 19th century. But psychiatric orders were seen mostly as biological. There was kind of, as I said, separation of philosophy and medicine was growing, was continued on its path, set with Descartes and that scientific perspective of separation of subject and object. And there were also, it must be said that there were also attempts to counter that trend. And for example, romantic movement and the movement in German, especially German context, called Naturphilosophie, which is a kind of nature philosophy, or emphasized harmony with nature and holistic view of human being, kind of building more on a humanist perspective, I would say. And some of the early existentialist thinkers, like there would be Kierkegaard, or Nietzsche would be another one, and some others. They resisted this rationalist, more rationalist and more abstract and separate dualist kind of approach to philosophy and science, and they saw illness as symbolic, as existential, as philosophical, kind of tried to return to that earlier perspective, and sought to reconnect subject to object and body to mind. Okay, so there were starting to emerge these trends to counter this dualism. Other developments during this time throughout 19th century were emergence of psychoanalysis towards the end of it, and other psychodynamic therapies. In the early 20th century, it would be like Jung and Adler. They split off of a Freudian psychoanalysis. And basically the main thing about that was the discovery of the unconscious, or formulation, maybe not discovery, but you could say discovery. It's the conceptualization of our mind is being fueled by something that we are not conscious. So something unconscious, irrational at the basis of our experience. And that was you could say, a revolutionary discovery. And talk therapy as an approach. So there was more personal meaning of what mental disorders were. They're more personalized, more, I guess, trying to bridge the empathetic gap, to understand the experience of people who are suffering. Also, another development was emergence of positivism. So that's the other trend of scientific revolution as it was kind of radicalizing itself. Positivism was basically about saying that science is the only valid way of gaining knowledge, and everything else is suspect. And so social sciences emerged out of that perspective, even sociology. And specifically, there was a connection to sociology as a discipline. One of the founding works by French sociologist Émile Durkheim was basically called Suicide. It was published in 1897, and he theorized it as a social issue, not just a private problem, and not an individual or moral failing. So looking at it from a sociological point of view, from all of society, and how it affects all of the society, not just an individual. And so it studied it scientifically. He classified 4 different types of suicide in that book. Egoistic, which happens because due to a lack of social integration, you're just separated, alienated. Altruistic suicide, which is over-integration. For example, like samurais in Japanese culture committing suicide, it was kind of the opposite of being not integrated. This is like over-socialized in a certain culture that suicide is part of. Then there's anomic suicide, and that's when there is social breakdown and normlessness. So when the norms are in question, when people are confused and they're more deeply alienated than just separate from society. Let's say if egoistic suicide would be, let's say an immigrant is not integrated with society and just decides to end his life. So instead of trying to overcome his difficulties, let's say, the anomic is like somebody living in that society, and just because society itself is undergoing a crisis and people are lost and the norms are no longer which is common to the modern period, this postmodern period, and it's a common problem in our days. That's why often people take their own lives for various issues like that. And then fatalistic is the 4th type he described, was excessive regulation and oppression. So you can say like in an authoritarian system, when you see no way to improve your life, and the only way out from the suffering you're experiencing is to end it. This kind of positivistic sociological approach, on one hand, it maintained the split of subject and object, but on the other hand, it helped decriminalize suicide by understanding better, by studying it, by removing the stigma slowly. For example, in Britain, it was decriminalized as late as 1961. So you can imagine, just like homosexuality was criminal until around those same times, these things take time, and to advance and to develop. And finally, we get to 20th century. We kind of started discussing it already. Philosophy was again seen as a therapy. One figure, important kind of figure in that perspective is Ludwig Wittgenstein. He's an analytic philosopher. He's a very towering figure in philosophy, history of philosophy, and we'll discuss him more down the line. But he saw philosophy as a kind of therapy for conceptual confusion, and so by practicing philosophy, you can remove this confused thinking and help yourself think better, and so remove some of the conflicts that may be living within your soul or your mind. The aim is not to give information, but to untangle knots in your thought. In the 50s, another development in the 20th century was the psychopharmacological revolution, which is important development because it's tied to the pharmaceutical industry and the profits that are made because of these psychotropic and various medication, which often they're not proven to work. It's kind of trial and error. We all know how they don't work well, and each particular person may not respond. So it's very, very, very much poorly understood. But these profit-making forces, like insurance industry, pharmacological industry, are pushing these over medication, and that's one of the criticisms that anti-psychiatry had in the 1960s. Finally, we get to where anti-psychiatry emerges as a perspective. There were a lot of philosophers and thinkers and psychoanalysts and people who criticized the mainstream psychiatry as it was kind of based in the scientific positivistic perspective, seeing it as a biomedical model to treat brain separate from the mind, and seeing everything as biological and not accounting for the existential or philosophical dimension of mental disorder and the importance of therapy through various other means other than biological and medicinal. This movement pushed towards deinstitutionalization. So a lot of, in America, for example, and other countries as well, a lot of state psychiatric hospitals were shuttered, and community mental health model was proposed and implemented partially. Unfortunately, the reform wasn't completed before it was kind of halted, and the funding was stopped. That's just, politics influences these things, unfortunately. Eventually it led to emergence of survivor movement. Survivor meaning those who survived the mainstream psychiatric intervention, seeing themselves as, seeing that intervention as also harmful and traumatic in a way. Which I can relate to from my experience in some ways. Then there's also a movement called Mad Studies or Mad Pride movement, focusing more on patient-centered perspective and trying to gain more humane and existential, humanistic, philosophical, and holistic perspective. Some of the thinkers in this anti-psychiatry movement, let me do this. Key criticisms and another moment of 20th century history which also played into this was Soviet abuse of psychiatry, which was a horrible in Ukrainian experience. Many dissidents who were opposing the Soviet system were actually treated as psychiatric patients because the Soviet ideology was, the communist Soviet system is rational, and if you're opposing it, that must be something wrong with you're mad. And so they were treated as schizophrenics and labeled as schizophrenics just by being dissident, and treated for psychiatric disorders, which obviously is abuse and torture. And so it was designed there was abuse of psychiatry to enforce conformity and discipline and eliminate the freedom of choice. So that played into also in the critique of mainstream psychiatry, obviously, even in the West. Just to kind of round it out before I go into specific criticism of anti-psychiatry, the suicide during this time was seen progressively more as a public health problem, not as a moral failure anymore. and it's caused, it became to be seen not just biological. As a result of this anti-psychiatry movement, it became seen as an interplay of biological, psychological, and social factors. The interplay of very complex interplay of biopsychosocial perspective. So it was more focused on treatment and prevention, critique of biopower that also connects to one of the concepts of Michel Foucault. He criticized how power gets over life, biopower gets practiced in societies, modern societies. And so the whole movement of anti-psychiatry was connected to a radical, very radical critique of social practices. It was part of the same moment. There was also a lot of exploration of Eastern religious perspectives like Buddhism, Hinduism, so on, spiritual pursuit and spiritual seeking of the 60s, of a counterculture. All of that environment contributed, it played into the anti-psychiatry, and I think they kind of fed off of each other, amplified one another, and so you have to consider those elements of it as well. And this is something that can be, and I will probably explore in the future episodes, these complex interplays and interesting interactions. But let's focus on the key criticisms of mainstream psychiatry. And this is now, this was advanced by anti-psychiatry, but it also applies to the critical psychiatry, which I'll examine a little bit more carefully in a few minutes. But these criticisms are the same for both of these perspectives. They share. You could say that critical psychiatry kind of adopted these criticisms from anti-psychiatry and just took a different approach of addressing them. So the criticisms are, first is medicalization of normal behavior and human suffering. So it's like you take something that is part of human experience, and that's a philosophical perspective would understand that the suffering and pain is part of human experience. It's not abnormal. It's not pathological. But it is within the perspective of mainstream and scientific view, positivistic view, and psychiatric view, it is medicalized. It is pathologized. It's seen as something abnormal that needs to be fixed rather than understood, empathized with, and maybe just accepted in a way, or adjusted, or worked with in some kind of more humane and more harmonious way, rather than trying to see it as a disorder, a pathological condition that needs to be fixed. So normal emotions and behaviors, depression or sadness, melancholy, different ways of saying, where does it normal stop and pathological begin? Not always easy to tell. Of course, there is a line, but it is not as clear as one would hope. So grief, for example, anxiety, ADHD, they're part of human experience or range of behavior, but often turned into disorders, quote unquote, right? So same example would be shell shock. In World War I, it was called shell shock during the war, when people came back traumatized by the experience of horrors of the war. But only after Vietnam, it became known as a disorder, as a post-traumatic stress disorder. It became labeled. So I understand it is a disorder, it is a serious problem, and it should be attention, and that's why it's relevant to the current situation in Ukraine and the mental health crisis because of the war. But it may be a more holistic approach, and seeing it not as something like abnormal or disease, but seeing as a normal reaction to an abnormal situation. War is a horror, and so post-traumatic stress is normal for somebody who has to endure those horrors. And so obviously it may develop into a disorder, and it needs to be attention needs to be paid and treated in some way. But maybe it's seeing it as some this alien disorder or abnormality that needs to be treated and fixed, maybe a more philosophical and existential and more holistic way of approaching it is a better way, and that's some of the contemporary approaches do approach it from that perspective. So second was overuse of psychiatric drugs, which I already hinted at, the psychopharmacological revolution of 1950s, and since then, obviously profit-making industry and interested in prescribing as many writing as many prescriptions as possible instead of only when necessary. So that's a huge problem. And third is coercion and institutional control in mental health treatment. So which led to deinstitutionalization, because forced hospitalization against somebody's will brings up questions of human rights, civil liberties, and involuntary medication. How do you reconcile dignity and autonomy, the humanistic values, with this kind of approach to treatment? So they may be seen as ethical violations of human autonomy and dignity. Not to mention lobotomies, electroshock therapy, and treatments like that, which were used indiscriminately in the past, and there were a lot of horrors that could be described. Another critique, the fourth one, was power dynamics and social control, related the same way: coercion, institutional control. This is more social and power control outside of institution, even seeing stigmatization and psychiatry, and even seeing mental disorders something to be normalized or adjusted, and to what is normal. If there's a figure of a normal obedient worker going to work, not questioning anything in his life and just working diligently 9 to 5, and never raising any questions of why he's paid why is he not paid enough, or why his medical insurance is not paying for what he needs to get treated, and so on. And just if any, just like Soviet abuse, if you start questioning things and you're labeled as disturbed or mentally disordered, where's the line between normal and pathological? So that's the connection to the Soviet abuse perspective as well. And then final criticism is a lack of scientific basis. As I said, sometimes we don't really know how our brains work. We know a lot more about it now with neuroscientific advances, but we still know very little. It's like a black box, and we are trying to approach it from different ways, but it's impossible, and it's connected to probably quantum level of reality and electric signals in the brain, and it's impossible to study it in a way that's beyond doubt, so there's always going to be some level of uncertainty, and but very often psychiatry and the insurance industry want to label everything very clearly, to draw rigid boundaries everywhere for their own purposes, and that's works against the experience, and it does violence to people who are suffering, really. So those are major criticisms. And some of the key thinkers in this anti-psychiatry, just to name a few: David Cooper. He actually was the one who coined the term anti-psychiatry in the 1960s. He's a South African psychiatrist, and he emphasized the political nature of psychiatry. He kind of criticized radical criticism of psychiatry, seeing it as a form of social repression. Another one was R.D. Laing. He wrote a book called Divided Self. In 1960, he saw, for example, his contribution was he saw psychosis or madness or an insanity, how some people call it, as a meaningful response to a disordered society, not just pathology. So he looked at psychosis, again, not by pathologizing it and seeing it as a disorder, but explaining it by interaction between self and society. And he emphasized the subjective experiences of madness, and completely rejected the medical model, completely. He didn't accept any of it. Next one would Thomas Szasz. Hungarian background. He wrote a book named The Myth of Mental Illness in 1961, and he argued that mental illness is a metaphor, not a disease, as other medical diseases may be seen, and that psychiatry serves mostly as a tool of social control. that was his contribution, main one. Michel Foucault I already mentioned. He wrote Madness and Civilization in 1961. Not a psychiatrist, but he was a historian and philosopher, you could say, and his analysis was foundational in many ways because he showed how psychiatry emerged, how it as a discipline and as a power structure. So he criticized, he just showed how the psychiatric practices emerged and were contingent and were normalized by those who had power and influence. Another was Franco Basaglia, an Italian democratic psychiatry movement in the 60s and the 70s. He led the deinstitutionalization movement in Italy, culminating in Law 180 in 1978, which closed mental asylums in Italy and emphasized community care. So it's a kind of counterpart of American deinstitutionalization movement in the 60s as well. Next, another thinker or pair of thinkers is Gilles Deleuze and Félix Guattari. They wrote a book called Anti-Oedipus in 1972. It's a famous Oedipus complex, which Freud formulated in his early psychoanalytic theories. Deleuze and Guattari argued in this Anti-Oedipus book that this theory was really they linked psychiatry pretty much to capitalist repression and proposed schizoanalysis instead of psychoanalysis as an alternative. They emphasized multiplicity of desire, multiplicity of experience, and let's say experience of schizophrenia, and how thought flows in a not in a linear manner. So they criticized the Oedipus complex as trying to force everything into rigid structures of the family, mom, dad, and the child, and that triangle, and not everything in our human experiences may be or can be squeezed into those rigid boundaries. So that was seminal work in many ways, not just in psychiatry. And so it eventually led to patient-led activism, as I said, survival movement, mad pride movement in the 70s and 80s. And ultimately in the 1990s, this critical psychiatry movement emerged from within mainstream psychiatry. So taking some of these criticisms to heart, people who are trained, possibly, most of them I would say, were trained in psychiatry, in mainstream psychiatry, in a biomedical model, but they were also I guess read or were exposed to this anti-psychiatric perspective and criticism, and they took it to heart and they started criticizing psychiatry from within. One example of this patient-led activism, by the way, which I mentioned just now, was Mental Patients Liberation Front. Sounds very radical, kind of like a militia almost, but they rejected forced treatment and demanded rights-based framework. So, consent, informed consent, no forced treatment, and so on. So just to contrast and to summarize again, the anti-psychiatry, mental illness was not a biological disease. They rejected biological model. They saw it as a social construct and a metaphor. Psychiatry was seen as mostly harmful, coercive, and an instrument of social control. Treatment was the anti-psychiatry opposed institution, forced treatment, and psychiatric medications. Drugs were tools of social control, according to them, and not legitimate treatments. Philosophy that kind of connected to this philosophical perspective related to anti-psychiatry would be existentialism, postmodernism, radical social critique. And there's actually an existentialist psychoanalyst perspective, which is an alternative to Freudian one, and some people practice that, and other existentialist therapeutic models of like Rollo May and Viktor Frankl. You may have heard some names if you explored these issues before. Suicide was seen by this anti-psychiatry as a complex, not necessarily a symptom of mental illness. Maybe psychiatry wrongly medicalizes many issues and problems which are actually moral, existential, and social decisions, and maybe expressions of personal liberty and autonomy, right? So again, this is philosophical perspective, taking back from Stoicism, through the centuries, it connects to anti-psychiatry. Also, think about, let's say, self-immolation by some Buddhist monks as an act of protest, or in some of the former Soviet countries. There were several I think in Czech Republic. There were several instances of students or activists setting themselves on fire just to make a point. So it's a suicide, but it's not a pathological. It was a act of protest, a moral stance, and an expression of personal liberty, right? So not all suicide is the same. And suicide prevention policies are often, they mean well, but they often may be forms of paternalistic control rather than genuine care. And even, let's say, organization, the American Foundation for Prevention of Suicide, for Suicide Prevention, AFSP. They do Out of Darkness walks, and they raise funds, and it's important. It creates community for families of people who died of suicide, and support. But sometimes it may create this kind of culture of that still maintains certain stigma of suicide, and still highlights the evils of suicide, and not and it creates this kind of culture of unacceptability, and this goal of eliminating suicide, which is probably a little bit of an overstretch, because I don't think it will ever be possible to eliminate suicide. And as I said, there are certain situations, it's an existential, it's a philosophical question, it's part of human autonomy, and so it's a very complex phenomenon, and it can't be reduced to something can be flattened or reduced to a problem that should be eliminated or fixed. It's part of the existential makeup of people, a human. It's a complex situation, so we can't really explore it fully, but to the extent that we can, obviously, I would like to, and that's why I highlight these complex questions here. So that was anti-psychiatry, and it's a more radical perspective. It rejected psychiatry as a pseudoscience completely, the medical model, and it's really a historical movement and no longer exists as a movement. Anti-psychiatry, it was influential in the 60s and the 70s, and then it kind of dissipated, leaving behind several legacies, which I will highlight at the end of this episode. And so, as I said, leaving lasting legacies. It really did change how people viewed mental health and psychiatry. But the consequence of those criticisms, as I mentioned before, critical psychiatry emerged from within the mainstream psychiatric discipline within medicine. So calling for reform from within, not as radical, not calling for abolishment of psychiatry, but for reform, and advocating for more holistic and patient-centered care, kind of responding to the criticisms, but suggesting reform rather than abolition, less radical answers to those criticisms. And it is currently active within the profession of psychiatry, and so it's like a child of anti-psychiatric movement in some ways. So the positions of critical psychiatry, to distinguish it slightly, is that mental illness does exist. It's not a completely constructed metaphor or that has no reality. Mental health illness does exist. There are biological bases for some of the, maybe not in all cases, but in many cases, and in most, maybe even cases, mental illness does have biological basis, although it is not limited to that dimension. So but the past psychiatric models tended to be flawed and reductionist. That's the critical psychiatry acknowledges that criticism. So psychiatry needs to be reformed, not abolished. Treatment, again, criticism of over-reliance on drugs is maintained in critical psychiatry, just as it was in anti-psychiatry, but it does not reject pharmacology and psychiatry altogether and entirely as only a tool of social control. The medication does play a role, and sometimes it is necessary, as it's not. It cannot be the only treatment, and it's not sufficient on itself, but it can be important as a supplemental therapy. So the pharmaceuticals can be used, but should not be overused and overprescribed, which is a big problem. Philosophy for critical psychiatry is more focused on scientific method, complemented by also social, political, and ethical dimensions of the questions being examined. But it's grounded in science, whereas anti-psychiatry was more philosophical, existentialist, as I mentioned before, postmodern, and radical in its critique. But critical psychiatry views suicide as, again, also as a very complex phenomenon and not reducible to brain chemistry or psychiatric illness alone, just like anti-psychiatry, but it challenges the biological model that sees all suicide as a result of mental disorder, right? So critical psychiatry acknowledges the criticisms advanced by anti-psychiatry, emphasizes the social, cultural, political, and existential factors that can factor into suicidal behavior. It focuses on dialogue, respect for patient's narrative, not trying to impose norms, external norms on the patient, and respect the autonomy and then existential need for understanding. So instead of just medication control and enforced treatment, suicide prevention should prioritize agency, context, and ethics. That's the argument of a critical psychiatry, and not just medical risk management. So not preventing at any cost. You have to account for autonomy, dignity, and other ethical dimensions. So mainstream psychiatry often oversimplifies suicide by ignoring factors like poverty, trauma, oppression, and existential meaning that is so key to us as human beings. So reducing people just to their medical conditions and just to sickness and to need to fix it. Key figures within the critical psychiatry are people like Joanna Moncrief, Thomas Insel. He was a former director of a National Institute for Mental Health, and later now he's a critic of that institution. Sami Timimi and Robert Whitaker. He is the one I want to show you. I have a book, a pretty famous book that came out a number of years ago, Anatomy of an Epidemic. Magic Bullets, Psychiatric Drugs, and the Astonishing Rise of Mental Illness in America. So he was one of the leading thinkers in that critical psychiatry movement. He also wrote Mad in America is another work by him. So those were anti-psychiatry, critical psychiatry, and I just want to highlight there's also several others. So one of the legacies of anti-psychiatry is that it led to diversification and diversification of approaches to mental health, spirituality, other, which I mentioned in the previous episode, esotericism, trauma-based focused approaches, body-focused somatic. So not just traditional psychiatry, take a medication and get treated. Much more diverse field today, and so one of those is a trauma recovery perspective and holistic healing approach. And one of those is one author, and he was a therapist also and doctor. I found very useful is Charles Whitfield. He wrote a great many books. One of them, very well known, is Healing the Child Within. It's about childhood trauma and how it affects development and psyche, human psyche in development. And this book is not crazy. You may not be mentally ill. That's kind of echoing the anti-psychiatry of myth of mental illness, right? So it's oftentimes people pathologize what is not a disorder but just normal human experience, and that's the argument of the book. And he's using as I said, he's a trained medical doctor. He just comes at it from a holistic perspective and from in integrating these criticisms of mainstream psychiatry. And one more perspective I want to highlight is a postcolonial perspective. That's also part of the, you could say it's part of the criticism and anti-psychiatric broader environment in the 60s and the 70s. The postcolonial critique was emerging in those decades as well. And one book, for example, that exemplifies it is The Globalization of the American Psyche, Crazy Like Us. By Ethan Waters, that sort of highlights how American model and view point of view on mental health gets exported through globalization and through kind of cultural imperialism, if you will, across the globe through various public health programs and in foundations and so on. So that's also an important perspective. And the related issue here is that which I mentioned, that Deleuze and Guattari criticized the Oedipus complex, and anthropology also, evidence garnered by the anthropological research shows that in non-European societies, many or developing societies which are not the same as European kind of Victorian culture, didn't go through the same stages, indigenous cultures don't have the same Oedipus complex. It's not present in their structure, family structure and psyche. It's Freud saw it in his Victorian society in the 19th century, and he thought it was universal to humanity. It's not. And anthropological evidence is proves that. Some of the works that question this imperialism of Oedipus complex were Sex and Repression in an Industrial Society by George Catlin, published in 1938, as early as 1938. Then Oedipus in the Trobriands, that's a Geoffrey Gorer anthropological work in 1955. And then there were many others, critical examinations of this since the 1970s, including the Deleuze and Guattari Anti-Oedipus. Again, just to reiterate quickly, the legacies of the anti-psychiatry movement beyond the critical psychiatry reformist movement within the profession of psychiatry. There is also, as I said, med pride movements. They celebrate neurodiversity, resist the pathologization of difference. So influenced by disability justice movement, anti-psychiatry, feminist theory, queer theory, and postcolonial thought. So all those different alternative ways of non-dominant, non-hegemonic ways that exploded in the 60s and the 70s, putting in question the dominant modernist and humanist tradition of Eurocentric tradition, also play a role in the field of psychiatry and psychotherapy. So neurodiversity, it's pretty familiar, the autism spectrum and the various ways of learning, various ways of perceiving the world are more acceptable today than they used to be, but there's still a lot of work to be done. There's still a lot of stigma surrounding this difference and different ways of seeing and perceiving and sensing the world. That's and why this all matters. I think it's pretty clear. Healing is kind of plural. It's not. There's no one path to healing. Healing is as varied as humans are. Meaning is very contextual, and every human is seeking his own meaning. It's not universal or standard. You can't just impose a certain formulaic way of living or way of seeing the world on everybody. That's social control. That's social engineering, even. That's oppression, and Soviet abuse of psychiatry is just an extreme example of how that happens. So the diversity is welcome, and it's the multiplicity of approaches is great, and the more holistic and humane it is, the better for everybody. The Ukrainian experience I already highlighted as well. The war causes a mental health crisis, and it's developing very quickly in Ukraine these days. A lot of initiatives to address the PTSD, both in the war, people who are participating in combat and people who are living with the constant bombardment or threat and anxiety of bombardment, or who had to leave and are refugees across countries in Europe and other countries in the world. That's also a huge trauma. So all of that is a part of the larger effort to decolonize and de-Sovietize Ukrainian culture, which includes psychiatry and mental health care. And it's in some ways it's making a lot of progress because of this experience, ironically. It's one of the front lines, you might say. Okay, so just to finish, this is a very heavy subject matter. I just want to say that this criticism of the system and of the mainstream psychiatry is not meant to undermine it or to reduce to make suffering of those people who suffer from mental health. Like I am one of them, so I understand and I empathize. And now there is a hotline for crises, 988 in the United States, and also you can text hello to 741-741 if you feel critical or if you need help. If you don't want to talk on the phone, you can text. There's different options available now to reach out and to. Suicide is not a joke. It's not a. While I'm talking about autonomy and various, it's part of the philosophical issue of approach to existential issue of human life and choice. It is a trauma to people around and people you leave behind. They suffer like I suffered because of my brother's choice, and my parents suffered greatly, and it causes a ripple. Ripples go out from this. It's not an individual problem, it's a social issue, and ripples go out far and wide from each lost life. So it's not something I take lightly, but it is a very complex philosophical question at the same time, and that's what I wanted to explore. Thank you for listening. Again, support Ukraine if you're not supporting yet, and if you can afford to do so. I also would appreciate your support for this content, financial or just by liking, watching, sharing, subscribing to my channel, so that my content is available and grow. My channel can grow, and I can continue doing this on a regular basis. Thank you very much for listening, and see you next time.